comparing the amount of budgets required for roads and for using just 1% of that for hepatitis. But really, we need to have a designated amount of budget put across towards hepatitis so that we can all work towards its eradication. The government of Maharashtra has a wonderful scheme where they help and work along with what is commonly known as the Anganwadi. These are housewives that help in the delivery process when women are pregnant and about to deliver. I think it would be a wonderful idea, and if there are people from the government of Maharashtra here today, if they can include this process of how to educate these Anganwadis in hepatitis and give them the opportunity that when they give and help a lady at their birth to also administer to them or teach them or educate them at least that they must have the vaccination done which can prevent their child from getting hepatitis. There are many schemes of the government of India which I notice and which I work for, whether it be Swachh Bharat, whether it be Beti Bachao, Beti Padhao. And I notice that there's some kind of a similarity in a lot of what happens. Dr. Prasad mentioned about Swachh Bharat, and as you know, which the speakers before me have educated you, that hepatitis A and E are waterborne viruses, and they can be prevented provided we have a clean atmosphere. And that goes along with what Swachh Bharat means. Education, and education particularly for the Beti, is very important. I've always maintained, and so have many other great philosophers of life, that when you educate a man, you educate an individual. When you educate a woman, you educate an entire family. And that, ladies and gentlemen, is where I feel we must bring our attention to, that all our women need to be educated so that they can impart that education at the time, let us say, for example, with the Anganwadi or the housewife in our villages and in our rural areas that need this attention most importantly. I have very little else to say, except that I look forward to the time and energy and my dedication and my devotion to this very worthy cause. I am here for you any time of the day or night, in whatever way you wish for me to represent this cause. I have dedicated myself to several other causes, and whatever you will designate for me, I shall be most willing to do that. I wish to thank all the organizers today, and I wish to say that may there be many such occasions when we can all meet and discuss and leave our impressions, because many a times people come and talk and go away. Perhaps that implies for me as well. I will stand in front of a camera and I will recite a few lines which are hepatitis promotional and go away. But I want to reiterate to the World Health Organization and to the Government of India and to all the associations that are going to be working, that please pay attention to that worker that will go out and propagate this cause right down to the common man. He's the most important person. I say this because when we worked for polio and its eradication, and the fact that we achieved this great victory in making India polio-free, it was that worker who went down to the smallest villages, to the interiors, and it is they whom we need to acknowledge and respect and honor. And they are the people that are going to work for you, sir and ma'am, that will help in propagating this wonderful cause. Please look after them. They are the people that will actually go and work in the fields, and we need to honor them. If ever there is any occasion when they need to be honored and you need my presence there, I shall be more than welcome to be there. Thank you so much.
Thank you very much, Mr. Bachchan, for your most inspiring address and for your emotional and very passionate appeal for eradication of hepatitis from our country. Thank you very much, sir, indeed. Ladies and gentlemen, we will now have key releases on this occasion. The first release is the report on blood banks assessment, which presents the current situation. I now request Honorable Chief Guest to kindly launch the Injection Safety Implementation Project, please. Ladies and gentlemen, the Injection Safety Implementation Project aims to increase the use of safety engineered syringes for injections in healthcare settings and reduce demand for injections. Thank you very much, ma'am, for doing the honors of the two important releases this evening. Ladies and gentlemen, I now invite on stage Mr. Nalinikanta Rajkumar, President of the Community Network for Empowerment from Manipur. He is one of the 5 finalists of a contest to Mr. Nalinikanta Rajkumar, receiving the WHO EASL certificate. Thank you very much indeed.
Dignitaries on the dais, Shri C.V. Dharma Raoji, Shri N.S. Kang, Dr. Jagdish Prasad, Dr. Poonam Khetrapal, the very legendary and the heartthrob of millions of Indians, including me, Shri Amitabh Bachchan ji, Dr. Hank Beckedham, WHO representative to India, Dr. Gottfried, Director HIV and Hepatitis WHO headquarters, Dr. Serene, our guests from UK, Egypt and Thailand, technical experts, representatives from the states and community, friends from the media, ladies and gentlemen. Namaskar to all of you. Hello, Mumbai. It gives me great pleasure to be here on the occasion of the World Hepatitis Day 2016. And it's indeed an honor that we are celebrating the Global Hepatitis Day this year in India. My senior, the Union Health Minister, Shri J.P. Nadda ji, had deeply desired to be here with us today, but for some unforeseen circumstances, he's been unable to join us. But he sent his good wishes through me for all of us. As you're all aware, viral hepatitis affects millions of people worldwide and kills hundreds of thousands of people every year. Almost 1.4 million cases of hepatitis A happen worldwide annually. There are nearly 24 crore cases of chronic hepatitis B globally and almost 13 to 15 crore cases of chronic hepatitis C globally. Every year, nearly 6.8 lakh people die from the complications of chronic hepatitis B infection, and 7 lakh people globally die each year from hepatitis C-related liver disease. India also has a huge burden of viral hepatitis and represents approximately 40% of the hepatitis B virus carriers and 20% of the hepatitis C virus carriers in the Southeast Asia region. The modes of spread of different types of hepatitis are well known, and we do have a vaccine for the prevention of hepatitis A and B, but lack of awareness among the general population on ways to prevent it is the key reason for the spread of this infection. And virtually everybody here has appealed today for raising awareness about all the various forms of hepatitis, which is the need of the hour. As is well known, hepatitis A spreads mainly through unsafe water or food, inadequate sanitation, and poor personal hygiene. In this regard, I would like to emphasize that our Honorable Prime Minister Shri Narendra Modi ji has launched the Swachh Bharat Abhiyan, which would go a long way to reduce the outbreaks of hepatitis A in communities with unsafe water and poor sanitation conditions. It's also well known that chronic hepatitis B and C are responsible for liver cirrhosis and liver cancer that has huge implications in terms of treating morbidity associated with them, as well as the loss of productive years of life. Modern studies have also shown that it is cost-effective to treat those with chronic hepatitis B and C. The Government of India realizes the importance of hepatitis prevention and is aware that India being endemic for hepatitis B, the infection is mainly transmitted from mother to infant at birth and through infected syringes. Hence, through the ministry's flagship program of Mission Indradhanush, the government plans to vaccinate all children up to the age of 2 years by 2020 for 7 diseases, including hepatitis B vaccine. In phase 1, we have successfully immunized 7.6 million children across the nation. And the work has been taken on war footing mode. One important step that's required in this direction is to increase the coverage of birth dose vaccination for hepatitis B from current 45% to cover 90% by 2020 for effective prevention of hepatitis B. The level and understanding of hepatitis C virus prevalence in the country is based on the estimates from small studies. These estimates indicate a broad range of 6 to 12 million people with hepatitis C, and the most affected population groups include the intravenous drug users who share the injection equipments, those with exposure to infected blood products, which is more common in patients on hemodialysis, people with thalassemia or hemophilia, and organ transplants, and finally, infections due to unsafe injection practices in the healthcare settings. In the absence of any vaccine for hepatitis C, prevention remains the mainstay of our response to this problem. And the main strategies for its prevention are ensuring safe blood, adopting safe injection practices, and giving injections only when essential, and among the intravenous drug users, ensuring that they do not share the injecting equipments. I'm happy to announce that we have taken in principle decision on an ambitious task of providing safe injections across the country using reuse prevention syringes, which will prevent transmission of hepatitis B and C, as well as many other infections. In this regard, the WHO is supporting us on a study project in Punjab. I would like to inform you. Access to adequate, safe, and quality blood and blood products is vital for any healthcare system, which is primarily the responsibility of the government or the National Health Authority of each country. India has 1,126 National AIDS Control Organization, Ministry of Health and Family Welfare supported blood banks out of the total 2,760 blood banks in the country, which forms 40% of the country's blood banks, but they're responsible for meeting 60% blood requirement of the country. 79% of the NACO-supported blood banks are in the public sector, and 21% are in the non-profit sector, such as the NGOs, the charitable trusts, the societies and foundations, etc. Recently, an assessment of the 1,126 NACO-supported blood banks was carried out on a standardized self-assessment questionnaire. On the basis of the responses, 1,101 blood banks were scored on a scale of 0 to 100 based on meeting essential standards for the transfusion services. The assessment report has been released just now and shows that seropositivity of transfusion-transmitted infections among the blood donors in the year 2015 indicates HIV positivity to be 0.14%. Hepatitis C was 0.32%, hepatitis B 0.93%, syphilis 0.18%, and malaria 0.04%. However, there's a huge variation between the states. This assessment exercise is being extended to cover all the remaining blood banks in next 3 months. Based on these reports, efforts will be made to minimize the transmission of hepatitis B and C from the blood. The recent advances have led to the development of new antiviral drugs for hepatitis C, which are more effective, safer, and better tolerated than the existing treatment options. In India, several generic companies have embarked in the production of these drugs at significantly low cost, which provides an opportunity to treat those infected with hepatitis C. And I'm happy to share that many states have on their own taken initiatives for providing hepatitis C treatment. I compliment
Thank you very much indeed, Honorable Chief Guest, Ms. Anupriya Patel, our Honorable Minister of State for Health and Family Welfare, Government of India, for your most wonderful address. Ladies and gentlemen, I have the privilege in inviting Mr. C.V. Dharma Rao, the Joint Secretary, NACO, Ministry of Health and Family Welfare, Government of India, to kindly propose a vote of thanks, please. Till the pledge board has been signed, kindly keep this occasion a little sober, please, because of today. And our respected members of the press and media, please do not block the aisle passages, because all the members of the audience would like to see Mr. Amitabh Bachchan, as he is going to sign the pledge board and also be here with us today. So ladies and gentlemen, do join us for dinner after that, and which is being served outside. Thank you for joining us, ladies and gentlemen, and namaskar.
I'm Health Minister from Himachal.
Minister Health Odisha. This is idea from media.
Side.
आगे से इधर
सर
एक
सॉरी बोला चलो भाई घर में